Please.
Artis,
Here.
Don,
Here.
Jim,
Here.
Jess,
Here.
Mike,
Here.
Pam,
Here.
Rod,
Present.
and Roger.
Here.
He's rising, going to a pledge. Pledge allegiance to the flag of the United States. One nation.
I'll make a motion to.
Second. Approved. Comments, we have no comments. We have no one online. Comments, and we have any. Citizen comment? Seeing none. In- Into departmental report. First one is animal shelter. Hello. Numbers are up there. At the cliff. On pretty. Getting pretty. And any visual study of our tool. Getting a lot of owners. Trying to get them out. And cats, so average started a bit low, but had a litter of kittens in there, so
I have a first comment. I see 45 adoptions a month in dogs, which was the highest. So congratulations, great job there. Second question is, what exactly is service?
so service out comes down to cats.
There's a service in on service out with dogs
Okay, so
and cats in. Question on both of them.
leave, and I can do some. I know this. That's going to be cats is going to be our farm cat type. Number is. Director Click. Help me. Numbers. And I'll give him the double check. Definitely.
Several of us had that question. And then the next question I have is, we had 3 dogs die, and that's 5% of what we had in the entire 12 months.
I that's for sure. I selected this one we got a that's the one that
All right, other than the clarification on those providing services.
thank you.
Good afternoon, all. Again, I'm Jill, the community health nurse supervisor. All right, so just starting with the immunization clinic. So we've seen an increase of visits this last month as we're starting to see an increase in individuals getting ready to see a lot of those individuals. We have also seen an increase in people coming in for travel-related vaccines and consultation prior to their trip. Just for fun, I looked into her travel-related appointments. We saw 33 patients in March. Most popular travel destinations from last month were Guatemala, Ecuador, South Africa, and Boston. We're getting on travel more. Other news updates, some of you might have already heard this, but this last week, the FDA and CDC updated their recommendations for coronavirus vaccine to allow people who are at least 65 years old or immunocompromised to receive a second bivalent booster to strengthen protection. And then going into WIC. So the WIC team has stayed busy with in-person and virtual visits. Last month, our registered dietitian, Stephanie Kimlick, passed her test and is now a certified lactation consultant, which is great. Had a full CLC for a little bit. We had 3 staff from the WIC team attend the Montana Breastfeeding Learning Collaborative last month. And then our home visiting program, as you can see, stayed steady with caseloads and referrals last month. Staff attended multiple trainings, including the Pediatric Mental Health Symposium down at Fairmont Hot Springs. And then just lastly on my updates is next week, our community health staff will take part in the Blue Ribbon event for child abuse prevention. It's on next Thursday, April 27th from 3 to 7 at the Fauquier County Fairgrounds Expo building. It's a wonderful event, free prizes, community programs, resources, bunch of people. So if you're interested, I guess. The theme is everyone's wearing that for child abuse. Yeah, that's community health updates. You guys have questions for me? Okay, want to help answer?
Yeah.
Yeah.
I see there. You're a certain time of year. Actually, it's more sick.
Right. So we'll start to see a trend in decrease of the shots, but actually we can give them all the way up till the end of June 30th. But typically it's very far and few and more people who are at high risk. Because we'll still see every once in a while some spring outbreaks, but we can offer it all the way till June 30th. Yeah, we'll start to see less.
Any further question? No, thank you.
Yes.
Is population health?
All right, good afternoon. So looking at the communicable disease side of things on the report there, as you probably noticed, I did add the monthly numbers for COVID-19 since COVID is now one of the reportable illnesses on an individual basis in state of Montana. So I'll make sure that that was included in the report for you guys. I did put it specifically towards the bottom, kind of its own category, so it didn't skew those numbers. But I wanted to make sure that that was in there so I can look at everything going on there. But if you want those displayed in a different manner, please let me know and I'll be happy to make changes to how those were given out. Syphilis and gonorrhea, unfortunately continue to be transmitted and we're seeing increases in those cases. Our STI disease investigator, Macy Doty, is doing a fabulous job on keeping up with that response effort. And unfortunately, what we're finding as an increasing trend is that these folks are using these apps that allow you to connect and with people anonymously. So unfortunately, it kind of makes things a little bit more sticky. It's hard to find those contacts because the individuals that we call to do the investigation on, they don't even know who as they connected anonymously. So we're continuing to do community outreach and education, working with healthcare providers to try to boost screening and testing efforts on their end, because obviously we're not able to get hold of those contacts to recommend screening and testing. So we're going to continue to tackle that and see how much we can And then as far as outbreaks go, as I mentioned last month, 2023 has been pretty busy so far, and within the month of March alone, our congregate living specialists have been busy with, we've had about 29 outbreaks that she's responded to and all of that. Majority have them been related to norovirus or just gastrointestinal illnesses that are not able to be identified just because testing wasn't done, along with the respiratory illnesses that are going around. We're able to collect. Been very, very busy, but things are hopefully not going to want to kind of slow down. And then lastly, on the other side of population health, more towards the chronic disease and injury prevention side of things, a lot of our health promotion specialists will be going over to Columbia Falls next Wednesday for a health fair that's going to be put on by or be posted at the Columbia Falls High School. So during the day, we focus really towards the students and doing health education to the students and offering some of those services and education and information and things. And then after school, it'll be opened up to the community. And then a lot of the parents or community members can come in and see what kind of services and health promotion information that will be available to them. So we'll be going in there offering tobacco, vaping prevention for as well as seatbelt education, car seats. And then our breast and cervical health program, the cancer screening program will be in there as well. They'll be busy. It's going to be a great event. They've held it for a few years now. It's been pretty well received by the community. Any questions? And
Just one, numbers. A lot of. How do you get this number?
so, the only a lot of those numbers are reported by healthcare. So it's mostly people that are going in and seeking care because of their illness, and otherwise the at-home test kits are not included in that number. So it's definitely underreported. And so it's the tests that are being done at the healthcare facilities, long-term care facilities, and clinics and doctors' offices. Question.
Thank you. Mandy is got home from sick for a sick trip today, but does anyone have any questions about family plans?
Okay.
I might be able to answer.
This on the number. There's first I can tell nationwide is program 90%.
Actually, I think the national average is actually not just the 35 last time she was here, and we're at like we're higher than national average. Yeah, I think their return rate was pretty low. I don't quote me on it. I know that. Do you guys remember when she talked about that? Forensic stage. Remember, Kehlani? No. Yeah, there's always going to be a lag time.
Other things done. We're getting enterprise actions, but if we're getting
No, we do have the Sharps program that we do have with the pharmacies as well. So we could be seeing some being turned into the pharmacies. So we go out, so we have this program, and I don't know if everybody knows about it. So we have the Sharps program, and it's actually in conjunction with the landfill. So we started it years ago because Dave Prunty and his guys were seeing syringes in the green boxes. So we were trying to stop that. So we have agreements with about 15 pharmacies where we go out once a month or twice a month, and we go and give them Sharps containers, to be able to give to any of their clients that go in, you know, there could be diabetics, there could be anybody that uses needles. They can be given them from there, and then we go back and we pick those up to all of those places. So they could be dropping them off there as well. There isn't we report on that with population health. And all we can do is estimate. Obviously, we can't count the needles and but if you look on the Sharps program right there, that's how many containers we're taking back. That's not in needles. I know that Mandy will estimate if they get a full container back, they'll get, I think she estimates about 100 needles per container. So if you look at the number of Sharps containers given, we gave out 225, and then we received 147 back. That was just last month. So, you know, we could be seeing them there as well. But I know we didn't have anybody in that position for the last couple of months. So they did hire somebody this last month. And so hopefully they will be able to start some more ways of getting those Sharps back.
Here. Thank you.
We have snowbirds. They could be taking them. So if you look at their summer months, usually our summer months, more containers definitely go out. The snowbirds might take them with them. I will say that some people use them as planters. So it's not an exact science, because we had a lady that came in and said, these are great for planting my tomatoes. So we had advised against that. So we don't know what they do with those. We're just giving them the option to be able to have them. They could have that, and they may not fill them up, you know, quickly. So they don't bring them back as quickly. There's no real science to those. I know that Dave's just not seeing the needles in the landfill anymore, like he was. Hopefully we'll let Mandy know, and she can also send an email out as well.
Right.
Good afternoon. This season, 2023 season, started off a little bit slower, later than normal. Since most years this starts in Lower Valley, summer, planning, but this year's wrote that. All mosquito larvae so far have been a large speed. We haven't found any. A little bit early for those. So far, it's myself and then Dave Nixon program. So we usually have 4 by now, but we are having 9 people. Know of anybody, send them our way. With that said, we're keeping up pretty well, but we don't have them yet and all that. So far, no equine cases. And it's early. As of the 17th of April, we've conducted 512 site inspections, 21 treatments, and covering just over 96. And then just after last season, we're hoping. I put a little map on there just to show you guys the amount of sites. That's just if I took a Lower Valley, South Bridge area, Egan, that you see a lot of the big farms down there. We do your size polygons that we have. So just to kind of give you a representation.
We had talked last year a little bit after that you lost your own, functionality of the drone. That you had, there were some areas you hadn't been able to figure out how to distribute chemicals on that.
Yeah, so that was something we took on this off season. Typically, or I guess the soft. So there's actually. Guess that. Have 150 that we have down cattails. That'll give them a goal. It's the first kind of trial season for that. I'm hoping that this.
Good afternoon, I'm Jim Wardensky with Environmental Health. The, I guess, first thing that I wanted to do is, as most of you know, we had a sanitarian vacancy on us, and they broke a lock, were able to pick up a phenomenal and people.
Hi, everybody.
So, yeah, you know anything about that process, trying to find qualified candidates for that same position. And I guess it goes to he knew Graceland, suggests in applications, so prepared for that. Because of Graceland qualifications, and she submitted her application for the sanitarians afternoon, and the following morning it's already accepted and issued her license for a sanitarian. So sometimes that takes months longer, just going through that process. That would, I'd also like to mention that Wendy Jacobs is here. She had been. Wendy is celebrating her 25th year as employee here with United City. Thanks to Wendy for all of. I would imagine that the health officer of the
I do, but you can too.
Okay, so Darren, I mentioned Darren, he was nominated for Career Achievement Award at the state level for being a public health employee. The criteria is that you have to be in that role, serving in that role. From Darren has 20 weeks. He was receiving that award in the Illinois. And I imagine the health online burn permit system, but I just wanted to give thanks the environmental health subcommittee and the commissioners was a support. Our chick paper testing that I talked about last go around, I think they've wrapped that up, and there were no positive results for salmon. That was good. The sample. One of the things that was kind of a carryover from my past life is volunteers. And because of some of the staffing shortages that bring in environmental health, I spoke with the health officer, deputy health officer, I'm sure that I was trying to recruit some folks. And you know, I did that. That's where they remain. They're not going to deal or any of that. It's all the county regulations and chart stuff. So I did reach out to that I know, and tentatively, we have 3 volunteers that are gonna be willing to come in. So, in our area, they'll help with, data entry, filing, some of the bigger projects that we have, like, training manual that I want to develop, standardized approach. Been trying to get back, on yes, and entering information on there, so that would be us. Some of those things I think that has to help out with, very capable of. Sounds like probably midsummer to early fall, they'll be willing to help us out, so get our workstation up, and try to schedule that stuff. Really an untapped resource. I did include a chart with the school inspections, and that was one of our matrix that we were focusing on. So as you can see, 2019 there, we had 0 school inspections. And in the notes below, I talked a little bit about this, differentiated between the facility inspections and the food inspections are completely separate. They're doing, all of those normal. As I saw these numbers, as I looked through the stuff, I thought, this really should be a matter of importance, talking about a high-risk population. And, some of the things that go into these inspections are, playground equipment and desks and chairs, a whole host of things where there's a potential for somebody. So I wanted to make this a greater emphasis. And one of the explanations that was offered to me when I looked at the numbers and kind of the dip in the numbers there is that you may or may not know this, but with some of the inspections that the food and consumer folks do for us, there's a reimbursement from the state. So they're tasked with trying to get to that 90% of inspections every year so that we get reimbursed for inspection. If we don't get to 90%, then whatever percentage prorated reimbursement. So that's always been, something of importance. And they said, unfortunately for these school facility inspections, we don't get reimbursed from anybody. And I said, I understand that, however, it's not a good excuse. So a couple of things have transpired. We learned through that reimbursement process, where it previously had been thought, as an example, within food inspections, you have a number of categories, retail food, host, things of that nature. The thought was that we had to get to each categories within a larger breakout. And talking with the state this spring, we learned that not each section, although that will still, it's the overall. So that grants us a little grace because like food, small inspections, food, mobile food units, and sometimes those are hard to track down, and other categories are hard to track down, just function. So with all that said, it freed up some extra time, and I said, okay, here's our opportunity to focus on schools. We also, some of the barriers that existed were people had cycled out of the school district and we didn't have current contact information. So I reached out to each school district and said, hey, who do we need to talk to from the maintenance staff or within your staff? make sure that we can schedule these. That information and things that we. We've also focused on two kind of timeframes, during spring break and then Christmas or winter break. Because that way we're not interrupting class as it's going on with students there. The inspectors, can more easily link up with maintenance staff at the schools, have unabated access to their school, conduct their inspections, and make their recommendations. As you can see, we're at 20 inspections for the year. We have 40 schools in that we service. Our goal for the metric was 50% for the year. My hope is that as we go calendar year, as we go forward into that winter break timeframe, we can knock out a whole host of order inspections there, maybe get to 100. We do have some septic permit challenges that are in the pipeline right now that we'll likely be bringing to you within the next month. Bring to the subcommittee and talk about. And we're kind of holding fast to that appeals process that may work to the variance process. And we've had to educate a number of people about that process. I think that we're getting more accustomed to that now, and we'll be bringing some of that stuff. The last thing that I'll touch on is we're continually evaluating our procedures and processes. And one of the things keep seeing the same kind of issues with septic permits, and where people, we understand that there's a backlog to that process, and because of a number of things, people try and get ahead of the process. The extreme where they're building dwellings, they don't even have a septic, or haven't even applied for a septic. One of the things that we try and reiterate to everyone is really before you even, maybe even purchase property, come talk with us, find out what, allowed. So that way you don't have this grandiose idea of, I build this and that and this and that, and then come to find out there are a number of restrictions that prevent you from doing. So what we've implemented is with other than consultants and engineers, because largely they do their own research when it comes to subject matter. Anyone else that's engaging in that process, before we even entertain the idea of taking a septic permit in, we're gonna prompt them to fill out a land research. Then once they submit that, we'll do that research and gather that information. And then those files are going to come to me. I will assign them to our staff members, and they will reach out to that individual either by email or a phone call, have a brief conversation with them, letting them know what the results of that research was. And if they want to have a more robust conversation regarding that, we can schedule an appointment. They can come in and we can talk more in depth. Otherwise, what happens is folks come in, they want to ask a question, just a question, and that turns into hours standing at the counter where somebody's getting tied up. So I think that this process will help in a number of ways. One, it will increase the level of customer service because everybody's going to get that email reference to their land research. Two, hopefully it will negate any kind of issue where getting ahead of themselves and they're filling out applications and paying fees and then subsequently having to refund money because it's just. And then acknowledging that that septic permitting process can be very complex. This way, they're getting guidance on the front end. Hopefully, it'll reduce the amount of work that we in environmental health have to do on the back end, trying to clean up whatever mess. So those are the types of things that, you know, each week we try and evaluate that stuff. Better way to do it. Collectively, talk about it, make that decision. Implement that.
Process if a landowner. They're in the office. Now,
Love to help you with that. The very first step in that process is to have you complete plan research request. And once you do that, we can have you do that here in the office, or you can do it online, whichever you choose. That'll come to our staff. We'll do that research. And as soon as we get that done, it'll be assigned to a staff member. And somebody will be giving you a phone call or email and talk to you about what the results were there. And again, if you need to have a more comprehensive conversation, then we can make an appointment.
so those folks then have to come back and apply.
Yes. And again, you can do that online and you know, as we're starting to do this, again, it's an educational process. Some of the people that have dealt with our office previously are like, well, okay, but I already filled out the septic permit, here you go. And thank you, hang on to that because it's gonna be valid as you go forward. And one of the decisions we made internally is we don't want to be holding on to all that stuff as it backs up. So, you know, we'll put the onus back on the applicant, they can hold on to that, and then once, because what they filled out in their septic permit may not even be valid. You know, they may be asking to construct some elaborate thing, and all of a sudden they learn they have a COSA, and they can only construct a single family dwelling when they want it. So, you know, what they filled out, septic application, may not even be able to occur.
Thank you.
Yeah.
I'm always impressed by it. Are there adverse reporting of adverse events that not justifies?
As far as the reports go, I mean, specifics when it comes to, so an example that I could offer is, at one of the high schools, in a shop area, the eyewash, once they did the inspection, was buried behind boxes, that nature. You know, so, and from a safety point, chemical storage, making sure that they have their MSDS sheets. Another thing that occurred is, legislatively, there are some pest mitigation that have recently occurred that the schools, I don't think, are aware of. They haven't been able to get policy practices. So, what's happened so far is, you know, as we meet with the maintenance staff, they don't have access to that stuff. It's likely held in a file somewhere. So what we requested is, you know, going forward, maybe they can create here and have that information ready for our information. I could go back and look at the details Action. And then talk a little bit.
That is part of it. Good. Have that experience. Wonder if there is any maybe support network.
Sure. Yeah. Well, one of the things, maybe if I'm understanding your correctly, is that to us or from us to the school?
From the
Sure.
what they need. Or is it your I just wonder if it's not part of what you. Yeah, we have to appreciate it. So.
Yep, yep. To my knowledge, there is no mechanism for that information to come to us. However, one of the requests that many of the maintenance staff asked is they, unfortunately, they ask for from their administration. And oftentimes because of budgetary constraints or whatever reasoning, it doesn't. They asked if we, as an organization, would feel comfortable generating letter sent to school administrators to kind of show the urgency. I was hesitant to engage in that. I didn't know that that was necessarily our role, because we do provide the results. So my advice to the inspector was to, refocus school district on the inspections, and then if they had more specific questions, we could. I guess I just didn't feel comfortable us trying to, mandate things with the school district. Our role is to then identify things that issues and, good things too, that occurs on those inspections. We identify the problems and then provide that feedback and
We can check with OPI and see if there is a reporting mechanism for injuries or things that happen on those. They may have that they have through their system. That may be what has precipitated this to go on, is that's why they've engaged the registered sanitarians. It happened a while ago, and I know that when we first went out, they found a ton of things, and especially rural schools of storing chemicals in, food sections. And it was pretty bad. So I put a note on, we can check with OPI and see if there is a reporting system.
You don't mind one more?
Yes, sir.
So after sanitarian comes out as a school, do they write up the
Yes, sir.
administration?
Yeah.
Do they expect answer back? Find anything?
I think that it's just on them to make the correction. And, essentially it's the same process of food inspections at a restaurant. You go in, unless there's something egregious, then they can do follow-up. In an educational process, and that's, I guess, job on it is although some of it is regulatory, more of it is compliance, through co-op.
Well, I do know from my time doing this. So you put the notes on them. Stay on. Passing it on.
Yeah.
Just-
Yeah. Right. Yeah. Thank you.
Like,
Oh, yeah. Good afternoon. This is the finance report for March. We had a budget, cash budget, cash balance of 1.2 million for March. compared to last year, about 1.6, and that was due to some COVID money that we got. As far as the report, no changes, everything looks good, and that cash balance is appropriate. Second, the budget has been the budget, which runs from July 1, 30 of 24. And we had a finance committee meeting not too long ago. We discussed that, had a lot of good questions. Participants in the subcommittee meeting and went through that. I can go through some of the details about the budget in general, or I can hit some of the highlights. General.
The highlights.
Total overall health department budget's 7.7 million, and the health department general fund is about 3.5. Grants as part of the total budget is about 3. Balances, animal shelter, mosquito. CIP. And just a quick breakdown of some of the things that affected the budget this year. Some of the grants are revenues were estimated, of course, because the grants are still on here. We're going to get more of the finalized numbers when those contracts come in. Payroll estimates this year, we're going to have a COLA that's estimated at 4%. And a greater portion of the health insurance dropped off a little bit, so which is good overall. And things that we're going to have to keep an eye on going forward, animal shelter donations count, good shape for next year. But going forward, depending on how donations come in, animal shelter, of course, is by the Florida County General Fund, and so we want to make sure that the county itself realizes that if donations or revenues don't, they may be taking on a little bit more of that. Next year, we'll. I've got the budget, the environmental health revenues projected. It's pretty robust, and we've got those revenues coming in, but I have made those estimates or reduce those estimates. The mill levy due through this process, estimating about 5.98 mils or so. The past few years had lower mills due to our cash balances that we had at the time. This year, due to those reduced mill levies in the past, we've used up those cash balances in order to and so back around that 5.9 or 6, just about $2 million. As far as FTEs go, changing FTEs for the whole health department changed by about a half FTE. There was a little bit of change for the administrative, environmental, animal shelter, mosquito programs, just a slight change. Those combined, the rest of it grant related. So, ready from. Coming up will be the Lehigh County Commission review on these. We've already had a county administrator on and that we went through, looked line by line on the budget items. There were no major changes in that, so that was good. The Lehigh County Commissioner got Mason, and that will be another. That's what I have for. So, any questions on?
Regarding the animal shelter and the donations, I know that the animal shelter is also subsidized by Friends of the Animal Shelter, which is the nonprofit that collects donations for them that they can use without having to go through the county. Do you take that into account at all, or look at that on?
Good question. More of just a comment. I want to thank you for color coding the word chart. It stood out, and it really does put it in perspective. So thank you for, immediate action on something that's simple, but it really does provide. Looking at that, thank you.
Thank you.
I think I need to go first. They take all the stuff I'm gonna talk about. Too thorough. To touch on those awards, we had 3 awards given at Montana Health Association and Montana Environmental Health Association, and the Early Impact Award was given to Malia Freeman. So that is somebody that has worked less than 5 years for all of the work that she's done through tobacco education, COVID reaccreditation, the TAW and the CHIP, and being a PIO on the fly. Truly appreciate that. And so she actually won that state. So it was a great honor. And I can't say this word correctly, exemplar. I don't know why. Yes, I can't say it. Okay, well, you said it. Lisa Dennison won that award, and she won it for our region, and just all of the years of service that Lisa has done, but what she has done, everything that she has done is to the absolute highest standard, and she holds herself to a high standard and to everybody she works with. And so it was a great honor to give those awards. And then obviously Darren's award as well for his years of service. And then I was also going to mention Wendy Jacobs, 25 years, but Jim took that too. So, and she did get a nice certificate as well from the county commissioners acknowledging that. And so did Jen Drew for her 5 years of service. So I do appreciate that the commissioners are acknowledging those milestones that for people that have stuck around with us through everything. So the burn permit has gone through. So that burn permit system will go into effect May 1st. Do appreciate the commissioners. I do also want to say the hard work that Jim and his staff have done with the work with DNRC, with the fire chiefs, with DEQ, with finance, with the county attorneys. It was a long process, and it was a very thorough process. Ben and his group did an excellent job of making sure everything was done in the right order. So with this new permitting system, we'll be able to basically turn burning on and off. Obviously, during those the fire season, we don't have any control over that. That is turned off by the Forest Service. So for July, August, and September, and sometimes into October if there's really bad season. And that goes to the county commissioners. But in the off seasons, we'll be able to do a permitting system where we can work in conjunction with our fire chiefs. And so what happens and what has happened over the years is that we think it's a great day to burn because there's good winds and good ventilation. And the fire chiefs are good, like pulling up their hair, going, why are you opening up burning? Because it's so dry, and the winds are going to be sustained winds of 20 miles per hour and could cause a lot of fires. So with this kind of interactive system, it's going to be when you go in to do a burn permit, you're able to get your burn permit for the year. The DEQ grant will pay for it, so it's not a cost to the burn permit holder. And they go in every day and they're like, I'm going to burn today, and they turn it on, and then they can turn it off. The great thing is fire chiefs can go on there and see who's all burning in their area, so they can have an awareness of what's going on. They still have to respond if there's somebody calls 911, but it also allows the other public to kind of go on there as well and say, oh, look, somebody is burning. I don't have to call it in. It's obviously a planned burn. And because you see on social media and those kinds of things are like, why is everybody burning? What's burning out here? Well, if it's on there, they can say, oh, they're doing a crop burning today. So it really allows that interaction and allows us to put education out, because there's a lot of people in the community that don't know anything about that we have a burn season and that you are allowed to burn, and we'll be able to push this information out. So it's been it'll benefit. I think it'll benefit. It'll take a while for people to get used to it. Fire Safe Kalispell permitting system that we used to have their website crashed. And so last year, everybody was doing handwritten permits to everybody. Which is, there's no way to track that. We need information to be able to give to DEQ about what's happening in our valley. And we didn't have that kind of historical data to give them. So this allows everybody to have this one-shot information and everybody's working. So it's a good collaborative process. Very grateful that this got put through, and I think the fire chiefs are going to be it. So I talked to Lincoln today and he was pretty excited. And then, yeah, they've kind of touched on everything else. Is there any updates that you need from me? They really did.
Are you doing any PSAs on the current permit?
Yep. So Ally Welling from DNRC and Milia will be working on that. And they have some things put together. We're going to try to push out as much as we can. Didn't really put anything out prior to.
Right.
And so it's going to be a slow rollout process. You know, we have to have permitting. We've always had permitting system from May and June. That's always been. Fire Safe Kalispell is going to have it on their their splash page. They're able to at least link it to this new one. So that will be able to do that. The what had crashed is the permitting system. So they could not do that. So people will be used to going to that page. So we'll be putting them there, and then we'll be working with all the state agencies and hopefully other Facebook pages and our own county page and try to get
Again, on that particular. Will that be obvious?
Yep, and we're gonna be able to do zones as well. And Jim's talked to them pretty well, but so when, you know, we have impact zones, when you can burn above 4,000 feet or 4,500 feet, and you can't burn on the valley floor, we can do that as well. And yes, we will be acknowledging that you cannot burn in Kalispell and limited in Whitefish, you have to work with Joe Page on that. I did co-responder. So the co-responder is now officially hired and under the umbrella of the health department. So we are pretty excited about that. She started on Monday. So the sheriff and KPD especially were very excited that she was back and back to working with us. We do have the application out for a second co-responder. So hopefully we start getting applications on that. And she is a licensed clinical social worker now, so she can work independently. So it's a good fit. We've worked pretty extensively, and I do want to thank the sheriff's office as well, that we worked really closely with Brian Hano to try to make it work, that she will be partially reporting to Kiwani, so we still have that oversight with the health department, and then also working with the sheriff's office. I think he's going to put in with Callaway. And then obviously Jeremy has done a lot of legwork for us to make sure that this pretty excited. That was a biggie. Dang it. Oh, yeah. Any other questions?
Any closer facility that
The crisis diversion.
yes.
So we do have that grant. We still haven't found one. We do have a, somebody has told us to reach out to someone. So we're in the process now to someone to try to get one of those, it's that 23-hour, 59-minute facility, at least to have a stabilization to be able to refer them to other services. But we're hopeful that's close, but it's hard to find.
Thank you. Committee reports. Finance committee have anything?
I actually, Kirk and I have been working together with the Weston. You know, it's, I'm gonna tell you, Kirk, he knows more than I do. Most stuff. I'm really impressed with his credentials and how thorough he is, and that he not only knows finance, he knows credit and about. So I'm really quite pleased with Mission and, where we are, and I know you've got it. And you and I are actually drilling down some more now. So, this is what I was telling Jen earlier. Finance is a boring stuff. Study is smart enough. It's just who wants to work with debits and credits. He does. And access to goods. And, when you do that, I think between and me looking at it from the outside, I think we can bring them eyes to maybe explain things in a way that would be more applicable rather than it reminds me of Alvin High School, but it's, get it, I'd say, yeah, but I didn't. Well, I got behind. And so people are supposed to get it and they say, yeah, but it's not because they didn't. It's just, so we're gonna, if you didn't get it, we're gonna just put it in a way that you understand it so that we can anticipate some. We've got a pretty good handle on it. You, I mean, I know the budget is, and then we're drilling in some other things. We'll maybe bring you up to speed if we find anything that we're in our.
The environmental health committee.
I think Jen spoke on it. Because all we did is talk about the burn permit.
That's all that we did.
Yep, that's all we did.
All right, board member discussion. Who wants to bring up any sport discussion? Roger, have anything you want to bring up?
Having a hard time hearing on the. We're looking at getting new microphones, by the way.
Oh,
That was gonna be in the budget.
all right, if no one has anything further, I'm move for a vote. Thank you, sir. All in favor?
Bye.
Aye.